Sometimes we're just so busy in our lives that we put our health to the last part of what we're thinking about when it comes to priorities. You can miss the signs of something happening to your heart.
It's important to catch it quick, and that's one of the reasons we have an entire month to shine a light on our heart health. And Dr. Kapil Lotun, Interventional Cardiologist at Carondelet, is here to tell us the importance of knowing about heart valve disease. It's great to have you on.
Thank you for having me.
Such a specific thing to hone in on today, because we think of our heart, but not usually specifically the valve. So why is it important to learn about that?
So the heart itself, there are three parts, multiple parts to it, but the three things which are important is the muscle, but it's really, think of it as a pump. So things come in and things go out. Things come into the heart and goes out to get some oxygen from the lungs, come back to the heart, and from the heart it pumps it to the rest of the body. So just like a pump, there are valves in it, and those valves have a certain function. So if think about it, if it gets clogged or if it's leaky, you won't get the pump won't work well. Whatever comes in won't go out well, right, or it will just backflow into the heart. So I think that's why it's very important to learn about. We pay a lot of attention to coronary artery disease and getting heart attacks. Well, valves also have a particular function in the heart, and that's really very important to know what they do and if there's something wrong with them. So that's why it's very important to know it.
And so when you're talking about getting clogged, kind of those valves clogged, what exactly is it doing to your heart when that happens?
So multiple things. So it does things to your heart, it does things to your body. Because if it's not working, your body's not getting the blood and the oxygen. What it does to the heart initially, it's just like if it gets clogged, for example, it's like lifting weights. Your muscle becomes big. At some point it just gives out. So your heart will give out and you'll get symptoms. You get a lot of symptoms. So you don't get blood to the rest of the body, your head, your rest of the body, you'll become weak, tired, a lot of other symptoms.
And of course, that's when you should take the signs that your body is giving you, see a doctor and get it taken care of and make sure and get it diagnosed if that's actually what it is. So what can we do to prevent this? I mean, aside from the regular exercise, and maybe that's part of what you'll say, but how can we specifically take care of our valves?
So it's very interesting. With valve is a little different. We have lots of risk factors, for example, for coronary arteries. With valve, there's some risk factors of coronary arteries which can lead to valvular problem. But usually valvular problems happens because old age, number one, and we have a lot of baby boomers, we have people who are in the elderly group. So we are seeing more and more of these valve diseases. But there's also the fact that once you're born, there's certain things which you are born with. And if that gets when you're born with them, it can manifest as a kid. Congenital in the sense, but there are a lot of congenital things which don't manifest until it's much later. So what happens is, because that wear and tear, like anything you buy, right, of a pump, there's wear and tear of those valves also, and therefore you have to pay attention to them.
So when it does manifest, what are the signs and the symptoms that we need to be watching for, and really with our partner or anybody in our family?
Absolutely. I mean, I think one of the things is before we go into that, if suppose a doctor says, or someone says, I hear a murmur or something, I hear a noise, I think you have to get it checked out, because you just don't know what the severity is. So things to look out for are things like you're short of breath, you're tired, and depending on which valve is involved, you might pass out or you're dizzy. A lot of people say, I'm very fatigued. So because they're not getting enough blood to the rest of the body.
And how do we treat this? Once it is found out, how can we fix this problem?
So it really depends on what valve it is. So, but nowadays, I mean, over the last 10 years, there's been an explosion in treatment options for this. So before, all these newer options, it was just a traditional where you went and got an open heart surgery. Basically, you open the chest bone, take the valve out, and sew in a new valve. Now there are a lot of things we can do from the groin, where you have these new devices which has a valve in it, and you can go ahead and put a valve in the heart.
Rather than having to have that open heart surgery.
Wow. And patients are awake for this procedure.
Really? Okay.
And they go home the next day.
Oh my gosh.
Yeah.
So not as
Technology.
invasive.
Technology. You
Science.
tell me, yeah, exactly.
Yes.
And there's an
science.
event coming up where we can learn a whole lot more about our heart health, right? Tell us about that.
So tomorrow tomorrow is the International Heart Valve Day, and although we just call it a valve day now because it's international now. So there's an event at Green Valley where there'll be food. So and then it's
heart healthy food.
Right.
And there will be myself and Dr. Shetty will be giving a talk on 2 different valve problems, aortic valve and the mitral valve.
Starts with awareness.
It starts with awareness.
So much to know. Thank you, doctor. Great
My
to have
pleasure.
you here.
Thank you very much.
And like the doctor said, Heart Valve Disease Day is tomorrow, and Carondelet's Structural Heart Team is hosting that event from noon until 3 at the Santa Rita Springs Social Center, and you can register online at carondelet.org/heart, or you can call them 833-245-1663 for more information.